So welcome to our Friday afternoon live Q&A. My name is Dr. Elena Klemenko. I'm a functional medicine internist in New York City. And today we're going to talk about seasonal allergies. We're entering a wonderful time of the year, which is spring, when everything is going to be blooming. It's going to be all these beautiful cherry blossoms and apple tree blossoms, but some people are not so comfortable with that. And so we'll dedicate the next half an hour to talk about what can we do to help these people from the functional medicine standpoint. But actually, statistically, about 40 million people experience seasonal allergies each year. That's a huge amount of people. As you probably know, majority of this people suffer through that and use either over-the-counter medications or possibly some conventional medications, but we can actually talk a little bit more in details what we can do for them. So today's agenda would be talking about seasonal allergies. What is it? What are the symptoms of seasonal allergies? And how is the immune system triggered by allergens? And the treatment option from the conventional standpoint, conventional medicine standpoint, as well as how does it differ from the functional medicine standpoint. And we'll talk a few words about how gut influences our immune system and therefore presentation of allergies. So as you know, seasonal allergies occur when the immune system overreacts to common environmental triggers, substances. And so your immune system is trying to get rid of those intruders by creating a variety of the symptoms. And it can affect a lot of our organs and systems. So it usually affects the eyes, nose, sinuses, airways, and even skin. So they're usually their port of entry where you inhale your pollen or allergen will be suffering first, but then other organs and system can be involved as well. So that we all know the allergy symptoms, sneezing, runny nose, congestion, watery red eyes, stuffy nose, but also systemic symptoms like fatigue or brain fog. As you can see, the clinical manifestation of the allergies can present on the skin in the form of itchiness or those hives, or even respiratory passages in the form of bronchial constriction, like people present with allergic bronchitis or allergic asthma attacks. The allergy symptoms can also affect the blood vessels when their vessel will expand and it will manifest as an edema or swelling of the skin, as well as gastrointestinal symptoms can be affected with that will affect the stomach acid secretion, and it will affect their gastrointestinal tract tremendously. So what are the environmental triggers? As you probably know, most often their environmental or seasonal allergies will be affected by triggers from the pollen, from all those beautiful blooming trees. But also it could be affected by pet dander or mold in the environment, of course, dust. Some of the cleaning products, more and more people are becoming sensitive to the cleaning products because they contain huge amount of chemicals that, by the way, probably never been tested on humans, but they're readily available with even innocent cleaning supply. So the potential allergens can act as environmental triggers to immune system within the skin or mucosal passages. As I said, will probably manifest symptoms of allergy in the port of entry. Either you have a contact allergy in the form of skin outbreaks or mucous membranes of your respiratory tract or gastrointestinal tract. So what is the allergies? The main player in the presentation of allergic reaction is, of course, mast cells. So remember that big player. So mast cell is their type of the white blood cell that is the key immune cell involved in the allergic response. When we are exposed to the allergen, say it's a pollen, and their allergen cross-links two or more antibodies, specific antibodies of IgE, which is immediate in allergic reaction, and both of them connected to the mast cell, that triggers that mast cell that is depicted here on purple to explode. And the cascade of signal causes the mast cell to trigger the release of inflammatory molecules. It's about 1,000 different inflammatory molecules that are expelled from this from the mast cell. And as you can see here, one of the main inflammatory molecule, or we call it mediators, is the histamine. I think all of us are familiar with that word. And the histamine mediates the key allergic responses that we're all familiar with. And they're responsible for the clinical presentation of wheezing, eye redness, mucous membrane swelling, or hives. This is all because of this degranulation, that's the word you might hear, or basically their explosion of this mast cell. So when we speak about allergies, sorry about that. So immune system imbalances will play a huge role how soon or how robust our immune response to their allergies will be. And the imbalances can definitely aggravate allergy, or many times we see that patients were healthy, or many of us were healthy, but then at some point in our lives, we develop allergies. And there's many factors that are well known what can trigger or potentiate or aggravate our immune system that will respond with allergic reaction. And those things are very common. For example, inadequate sleep or rest. Makes you think how important it is for us to get the adequate amount of sleep. High psychological or physical stress, right? So many people will develop allergies after stressful events, or just from environmental load, right? From environmental pollution, from not just chemicals that we expose to in our air or in our cleaning products, but also in our food, or in after medications that could be also pollutant in our lives, or even vaccines. So the diet that is filled with their lot of simple carbohydrates, the typical American diet or standard American diet, SAD diet, but all of those things are linked to their increased intestinal permeability or leaky gut, and we'll talk about this briefly, as well as some of the hidden infections that compromise our immune system and lead to their immune system imbalance, can be that culprit trigger that can help, unfortunately, cause their manifestation of their allergies in our lives. And what are those stealth infections? It could be your chronic viruses. It could be hidden infections like your dental infections or sinus infections. Sometimes they're misdiagnosed or mistreated with antibiotics, and that's where we get additional factor that can change the microbiome of our gut and bring us even closer to immune disbalances and therefore allergies. So if you, as you can appreciate on the picture on your screen, their gut imbalance or intestinal permeability or leaky gut will cause the weakened immune system. It will also cause a lot of other symptoms like digestive discomfort or brain fog or food intolerance or chronic inflammation. And the reason I want to stress this fact is that all the allergies start from the gut, many of them, is because I see that people who come with the onset of the allergies, I've never had any allergy problem, and all of a sudden I'm allergic to the blossom in Central Park. It happened because, and they also have these digestive symptoms. So we always connect those two very important systems, your gastrointestinal system and immune system. So you all know probably about the treatment options that you encounter from your conventional doctors or nurse practitioners or physician assistants, or just treating yourself with the traditional approach. We have several generations of antihistamines, like diphenhydramine, which is Benadryl, or a second generation of non-drowsy antihistamines like Claritin or loratadine, and other medicine, or decongestant medications. And now we can even buy the steroid nasal spray, like fluticasone, in over the counter. You can buy all those things, but they are effective. But as you probably know, they just a band-aid on the problem. They never really address the root cause of their why the allergy is happening. So what is the difference in functional medicine approach? First of all, we always talk about avoidance, or how can we reduce the exposure of patients to the allergens that is triggering the allergic symptoms. We do recommend air filtration in the home and the office. We recommend for patients to do the nasal irrigation, especially during their allergy season. Especially right now, all my patients get instructions of getting a normal saline nasal spray and use it abundantly, especially when you come from outside to indoors. Wash off those mucous membranes from the exposure to pollen, from the exposure of those allergens and antigens that will cause degranulation of the mast cells. Also, if you're experiencing allergy season only periodically, only when in the springtime or the fall time, that would be really helpful if you keep the anti-inflammatory diet during that time to reduce the burden of inflammation in your system. Stress management is extremely important during the time of allergies, but also all year round, but especially when we manifest the symptoms of allergies. So stress management, make sure you have adequate sleep. The stress management technique like deep breathing, diaphragmatic breathing. We do teach our patients to do heart math, which is the great technique that trains your brain to improve heart rate variability and improve tolerance and resilience to stress. And also, what is really important part is the targeted dietary supplements. And there's many options, so it's better work with someone who knows what you need, exactly what in your particular case you might need to control and address the root cause and symptoms of your allergies. All of that will prevent you from getting complications like infections and need for antibiotics or steroids. But addressing leaky gut in the treatment of their seasonal allergies and allergies in general is extremely important. Many of you are familiar with this picture of leaky gut. That is a condition where the intestinal barrier is compromised, as you can see on this picture. And this compromised barrier, because of the inflammation, as you can see on the right side of this picture, makes the intestinal content to penetrate through this barrier and end up in the bloodstream, where immune cells will start reacting to it by producing antibodies. This can trigger excess immune reactivity to the environmental toxic exposure. And therefore, you're losing that tolerance to the substances that you used to tolerate just great. You used to tolerate wheat and you used to tolerate dairy, but as the life goes on and you going longer and longer through the periods of this leaky gut, now you're getting much more reactive and intolerant to food, to the environmental factors. You develop allergies, asthma, sometimes eczema. We start reacting to dust, mold, and other environmental factors. And we develop nutritional malabsorption and malnutrition that further takes you to the place of being unwell and being chronically ill. So then additional recommendations for treatment of their seasonal allergies, as I mentioned, is of course clean diet. What does that mean, clean diet? Well, Mediterranean diet that you probably heard plenty of, but with some restrictions. During the season of allergy, we recommend to avoid dairy. Why? Because dairy will produce a lot of mucus, even in the good day. But when you are already inflamed, when your mucous membrane is already swollen, and produce a lot of mucus, You don't want to aggravate that process even more. And then, of course, there's some anti-inflammatory supplements like omega-3 fatty acids or vitamin D that you want to keep the level up to between 50 and 80. And the only way to know is to test. So ask your doctor to test your vitamin D level. And of course, probiotics to keep their microbial milieu in your gut in the most pristine and most balanced way, so your immune system can get a chance to cool off. But also there are some supplements that are specifically indicated to relieve the allergies, like stinging nettle or quercetin or bromelain. What do? So stinging nettle, for example, balances inflammation and prevents mast cell activation, when quercetin will stop the histamine release by stabilizing mast cells. So this is a great symptomatic, but much deeper than just blocking histamine reaction. It is preventing those histamine producing cells, mast cells, from degranulations. Remember, mast cells carry hundreds of different other mediators that will create inflammation and call other cells to the place of the disruption, of the place of that mast cell degranulation. Bromelain, as you know, is the ingredient of their pineapple, will break down the circulating allergens. It is the enzyme. It's actually digestive plant enzyme that gets a great anti-inflammatory effect. It will break down not just allergens, but also immune complexes that are formed between antigen and antibody that your immune system produces. So bromelain will start breaking that down and helping your immune system not to be so inflamed. And it also helps the quercetin to be absorbed and thin the excess of mucus. Also, don't forget your beautiful vitamin C. It has so many beautiful applications in the body. It's a great antioxidant, but also stabilizes mast cells and deactivates histamine, helps your body to break down histamine and get rid of it. And of course, N-acetylcysteine or NAC is a great antioxidant support. Remember, it is a precursor of the anti-aging molecule glutathione, and it also thins out the mucus and drainage. I remember when I was back in my residency many years ago, it was 25 years ago, we actually had N-acetylcysteine as a liquid that we can provide for patients with asthma and for people who have a lot of bronchial mucus as an inhalator. And it will help people to break down mucus and cough it up. What a great and easy and very inexpensive way to help patients. But I don't know what happened now. I think nobody is using it anymore because we have fancy, expensive medications that supposedly work better, but it's just dying medicine, unfortunately, in conventional setting. So what can you expect if you come to the functional medicine provider? And where can you find functional medicine provider? I actually get a lot of calls and inquiries about where do I find a practitioner who practices functional medicine in the right way? Because maybe you notice that functional medicine is a buzzword. A lot of doctors now say, well, I practice functional medicine, but actually they don't really have adequate training on it, or they probably don't know all the nuances of functional medicine. Look for functional medicine at the Institute for Functional Medicine, ifm.org, and look for a certified practitioner. That person most likely will get you through the right path towards your wellness. But what can you expect when you come to the functional medicine practitioner is you always will get a personalized health plan. You will get a comprehensive evaluation to look for those triggers or contributing factors of your allergies. They will probably order some functional medicine laboratory evaluation to get even more answers on the questions that you or practitioner might have, along with the conventional blood test. We do not ignore our conventional labs as well, because they give us a lot of information. We will definitely, the provider will look for the root cause of the conditions. Is it your environment? Is it your diet and lifestyle? Is it your stress level and your resilience, your sleep or lack of? And of course, nutritional deficiencies or insufficiencies. For example, we run a great micronutrients test that looks at the nutrients not only in the blood, but also inside of the cells, intracellular nutrients. As I always teach my patients, what's inside of the cell is what is similar to what is in your saving account, in your bank. Your wealth is really evaluated what's in the cell. Your nutritional wealth is what is in the cell, not what's in your bloodstream. Because body will do everything possible to maintain a normal, maybe not always optimal, but normal level of nutrients in the blood. But what's going on inside of the cell? That's where your reserve is in case of their dark days. And the practitioner always changes, will ask you to change any imbalances in your lifestyle or environment and according to your personal needs. That's what the functional medicine doctor will do. So most of our patients greatly improve the treatment that supports the health resilience. We start always with the diet and lifestyle improvement. We developed a targeted supplementation plan. As you see, there's a lot of supplements can be used for treatment of seasonal allergies, but does everyone need all of those? Maybe not. And maybe some people need to focus on gut before we treat their immune system. But experienced functional medicine will walk you through this path and will able to explain and help patients to achieve significant and maintained improvement and ongoing care. We also utilize a very interesting treatment for the treatment of variety of the allergies. It's called SAAT technique, or Solomon auricular therapy acupuncture technique. And Mark Bystock, who is on this picture, is our acupuncturist in the practice. He does this technique, and it's literally close to the miracle how he can help people to desensitize allergic reaction or allergic responses just with a simple single treatment of the ear acupuncture. It's really unique modality, and it basically reprograms your body, the immune system of your body, to overreact to allergic triggers. It is minimally invasive, and it involves a placement of very tiny beads slash acupuncture needles in the earlobe in the specific points, and therefore relieving certain pathways that are correlated with the Chinese medicine channels, to relieve the stagnation and congestion that happens due to the allergies. And it's like a vicious cycle. More stagnant or more congested in those pathways, sicker you are, and more allergic symptoms you may present. So relief of those pathways through the ear actually works miraculously, close to miraculous. So it's really minimally invasive. It has a broad spectrum application, from food allergies to environmental allergies, animal allergies, substance allergies, and even alpha-gal, which is their very uncomfortable allergy to the red meat that some of us acquire from tick bites. It really has a really high efficacy. So if you're suffering from allergies and you want to reduce your allergy burden, please consider a SAD therapy. It has a targeted treatment because the allergen will be identified during their treatment, and it has a really long-lasting effect. He has some great testimonials and great stories of success with this SAD therapy. And it works as an immune system modulation. In my patients, I've seen allergies to mold resolved. I've seen allergies to food resolved, and seasonal allergies as well. So consider SAAT. So if you're new to our practice, take a quiz by scanning this QR code. Sign up for the discovery call with my staff, or we can chat after this live Q&A. Follow us on Facebook or Instagram. We post a lot of interesting materials. Subscribe to our YouTube channel where you can watch other videos that I recorded to educate my patients and other people and become a supporter of the functional medicine. So here's more information how you can get in touch with us. This is our telephone number, 212-696-4325, or just go to our website, and we have live support through their texting. So sign up and get your questions answered. We are promoting this allergy defense trio pack that includes N-acetylcysteine, vitamin C, and anti-inflammatory turmeric, as well as the probiotics and magnesium. So all of those things are great for gut and for treating allergies. As you probably know, hopefully I convince you that to know that gut plays such a central role in our health, and all diseases start with the gut, and many cures of chronic illnesses will start with the gut as well. So I'm happy to introduce the Whole Gut Wellness Program that is now available. Not only do it yourself, which is very simple way to follow videos that I recorded, but also get a support, clinical support with the weekly group meetings with our practitioners. So we have health coaches as well as functional medicine practitioners and myself. All of that is the package in the group therapy, 4 group sessions, and also with the materials to review. Really easy way to learn about the gut and actually start making changes without big investment into seeing the doctor on one-on-one. So also enroll now with this program. You can get $50 off. So feel free to scan this QR code if you want to try to start this process on your own, and then maybe sign up for their group coaching. So that's a great way to start your education in the health changing environment. Right, so if this is another QR code, if you want to join the Whole Gut Wellness Program. And of course, we are still open for new patients. So if you're already existing client of the practice, feel free to refer your friends, because friends usually don't want friends to go to the bad doctors. You want the best for your friends. So you can refer them to us, and we'll be happy to take care of them. So thank you so much for attending today's live Q&A. Write down this code that will help you to get 10% off for my e-store, which you can find by logging into my website. And with that, I will be happy to open the floor for questions and answers.